medical community have all been excited at the prospect of stem cells being able to actually restore function that has been lost. And even more so in neurology, because the brain is not as good at repairing itself as some other parts of the body are. However, we've also all grown frustrated at the slow pace of clinical advancement in the field of stem cell research. Although stem cells are used off-label in a variety of conditions, they are only FDA approved to treat leukemia and other blood diseases, mostly in children. And in 2024, stem cells were approved for something called graft versus host disease, also in children. Ethical considerations, technical challenges, and the need for rigorous safety testing have all hampered stem cell research over the last few decades. Stem cell treatment is also very costly and usually needs to be individualized to one particular person, making it difficult to scale up production to reach a large group of patients. This is not even to mention the myriad of other factors that need to be figured out, like the dosing, the route of administration, the frequency, as well as all the different characteristics of a particular patient that may influence how well stem cells work. In MS, it is first important to differentiate between hematopoietic stem cell transplantation, or HSCT, as a disease-modifying drug, versus a stem cell study to repair the damage in long-standing MS. HSCT uses chemotherapy to wipe out a patient's immune system, and then stem cells are given to reboot the immune system so that people have a new immune system without MS. While this has been shown to be effective, there are significant safety concerns, and while some patients can go years without more MS activity, most eventually do see a return of their MS. At Tisch MS, we have completed 2 FDA-approved trials to evaluate the safety and efficacy of stem cells to repair the damage from multiple sclerosis. Phase 1 studies are simply to determine safety, and we did see a statistically significant improvement in our Phase 1 trial, but that was unblinded and not controlled. In Phase 2, we still saw improvements in overall disability scores, but they were not significantly better than the placebo group, which was, of course, disappointing. We did see some statistically significant improvement in a subset of patients. So now we are trying to identify the type of patients that will most benefit from stem cells, as well as the right dose and frequency of administration.